Okay, day 2 of Colorectal Cancer Awareness Month. Let's talk about what your bleeding pattern is telling you. Now, we previously were told anytime you see any blood in your stool, it means you have cancer and you need to get it checked out. While bleeding with bowel movements is not normal, it's not always bad. So let's talk about it. First, let's talk about the color. Bright red versus dark blood. Dark blood usually looks like your stool is just black or darker color than usual. What that's telling me is that the blood is coming from somewhere up higher in your GI tract, either in the more proximal portion of your large intestine or even your small intestine or your stomach. What ends up happening is the blood gets oxidized, so it turns to a darker color. Then it also mixes with your stool, which is what makes your stool darker. In contrast, bright red blood means that it's coming from lower down in the GI tract. It has not had enough time to oxidize and mix with the stool and become dark. So what bright red blood tells me is that it is coming from either the rectum or the anus, which is where hemorrhoids are. Sometimes a very, very brisk bleed in the sigmoid colon or other parts of the large intestine can cause bright red blood, but by and large, bright red blood means it's coming either from the rectum or the anus. So how is that helpful? Essentially, if you're telling me that you're having dark blood and that's been going on for a while, or your stools are a darker color, that means that the way I investigate this is usually through a colonoscopy. Whereas if you're having bright red blood, this is often sometimes an exam that I can do in the office where I either feel with my finger if I can feel a hemorrhoid, or I can look inside with what's called an anoscope, a small scope that we look on the inside to see if we can tell that there is a bleeding hemorrhoid. Now, if the bleeding only happens with bowel movements, that's usually something that, we can treat with medication as an outpatient. Sometimes we can do it, if it's an internal hemorrhoid, we can do it with rubber banding in the office. Now, if this is bleeding that happens between bowel movements and it's a lot of bleeding, then this is usually something we might need to go to the operating room for, so we can look at it and take care of it in the operating room. So if you're having bleeding and you go to your primary care doctor or a gastroenterologist or colorectal surgeon, make sure you tell them exactly the color, when it's happening, and how long it's been going on for. I'll see you tomorrow for day 3.